Hello and welcome to today's episode of Dr. Simone's Mindspace. Today live from Monaco in Seefeld, Zurich, a beautiful cafe in the city center with a beautiful shop and really wonderful coffee and matcha lattes. So a really feel-good place. I happen to spend a lot of time during these past 4 years of IVF treatments, and in our monthly series in our practice at Optimal Performance Zurich in Zurich Enge, we are going to talk about infertility. Despite the bodily changes and impacts fertility treatments have on women and men, depending on the medical intervention, of course, the psychological impact is extensive. Being confronted with infertility usually leads to depression, anxiety, emotional and physical exhaustion of both partners. Sometimes couples even separate because they cannot cope with the challenges and the strain on the relationship. It's, however, completely normal in a situation so extraordinary and very common to feel in the process of IVF or other reproductive treatments. What a lot of women and also men share is that they feel very lonely in this place. Even if so many of us experience it, going through the process of IVF or being confronted with other fertility treatments, it's something people do not talk about. It's very stigmatized. It's very taboo to share. A lot of times people only share when they succeeded, which is obviously sort of a false belief of everyone succeeding, which is also not true. And I think, therefore, it's important to be able to share and dare to share before you actually succeeded, or on the way to succeed at least, but not yet there. And I think it's very, very important to share in general, to just destigmatize. There's so many apps for pregnant women and their partners. I wish there would be just one, not even as close as good as the best pregnancy ones for people undergoing IVF treatments or other reproductive treatments, because there's so much described how you feel emotionally and physically, and it's just struck me how this is exactly a lot of those symptoms that you go through undergoing IVF treatments. But there is nobody talking about it. So you're completely unprepared of all these challenges that you encounter. And by being so alone with them, it's even more difficult to cope with them. So I really, really wish that this podcast series and also the podcast in general, and to just simply talking about the topic, is helping women undergoing treatments. I've just recently, very, very unclever, received a book on a woman's sort of autobiography of her life, and it felt so, on all her miscarriages, and it felt so like attention seeking, really nothing I would ever recommend other people to read, because it was really not the way you would want to hear. You want to hear about the genuine way of an experience, how you genuinely feel, how you genuinely experience things, and not sort of an attention seeking behavior of a person, especially when succeeded. And therefore I think, for example, the book of Michelle Obama has an episode where she describes their challenges, and she describes it in such a humble and normal, non-spectacular way, which is really sort of giving you a glimpse of how it can feel And also this idea of being high achieving people and then suddenly being confronted with something you absolutely have no control over, and how challenging that is and what that means and how you have to deal with it. So these are all aspects that I think are incredibly important to discuss, and these are the ones that I do work with when I'm working in my clinical practice. And of course, undergoing treatments also impacts your physical body. And there, my colleague Darinka is an incredible physiotherapist who helped many, many women having like lower back pain, completely terrible, hard to be able to move due to this hormone overkill of the IVF treatments, and also all the water in your body. There she can do lymph drainage and other treatments that help to at least relieve some of the burden and be a place to be listened to and understood. So I hope that this has been interesting for you. I'll continue this series, obviously, and look forward to your feedback. Have a wonderful evening, and I'll be talking to you again about infertility and its challenges, its ups and downs very soon. Take care. Life from Zurich. Have a nice night. Bye-bye.